To you. Shivab, see this. These are three anticoagulants mainly used in the hematology lab. Number one, this is EDTA, all capital. This is written here. This is the chemical. This may be sodium, this may be potassium. Oblique. This vial, this is potassium. Potassium EDTA or sodium EDTA. This all capital. E for ethylene. D for diamine. Ethylene, diamine, tetraacetic acid. But for me, for practical, EDTA is sufficient. Some abbreviations are used internationally and we accept them. If you want to memorize this for your theory, okay, up to you. But here, this is sufficient. EDTA. Second is ethylene, diamine, tetraacetic acid. Now, this is sodium citrate. This is another anticoagulant. This is written here. Sodium citrate. Usually we use this in 3.8%, 3.2% concentration. Why 3.2, why 3.8? This is almost same. The water molecule is there, but we don't go in these details. Whatever is there. Sodium citrate. This is written on some, when you perform the test, which anticoagulant you are using. This we use for coagulation profile. Next semester you will learn these things. There may be more tendency for coagulation. There will be less tendency. If there is less tendency for coagulation, what will happen?
Clotting.
Less clotting means bleeding tendency. Opposite. More clotting means thrombotic tendency. There may be thrombus formation, then this can leak or coagulate. This can result in myocardial infarction or this cerebrovascular accident, shallow, and many things like it. So to evaluate coagulation sequence, we do these tests. Coagulation profile. PT, APT, these are two main tests, but you will learn this in next semester. So simply memorize this coagulation profile or coagulation tests by sodium citrate. There are many, but you memorize like this at this semester at least. And this is heparin. Sometimes we will do some osmotic fragility test or some other test. Heparin. They will use this as an anticoagulant. These are used in the lab or lab. There will be some oral anticoagulant or same this heparin also for treatment as a drug. Understand? That is different. You will learn that in your theory. Here we are talking about the practical, in collection of the sample. Yes.
Each color is special.
Yes, I am coming.
For one.
This is, you can read it, this is written on it, but many people working in the lab, for example, technicians, they cannot read English. So this cap is specific. Even they can see this cap. This violet color, this is for EDTA. This blue color, sodium citrate for coagulation profile. This green color for heparin. This is also specific. Understand? Similarly, if you need this sample for serum, many serological tests like glucose estimation, liver profile, liver function test, many things like this, or many tests we do from the serum. So this is for serum. Nothing added into this. No anticoagulant, nothing is inside. So if we take the blood here, this will clot. After clotting, we can centrifuge and remove the serum. Or we can wait. This will take a long time, 24 hours like this. Then there is retraction of the clot, it will suffuse. And
the serum will be out.
After half an hour, 1 hour, at 37, This will clot and then we can centrifuge for a few minutes. So serum is up. What is the difference between serum and plasma?
Serum with the not clotting factor.
In serum, not all, some of the clotting factors are consumed, used. So this is not blood as such. Everything is not in the same concentration like in blood. Understand? This is serum, fluid portion, but some of the clotting factors are consumed. But in plasma, we add the anticoagulant, everything is as such. When we centrifuge, cells will settle down, fluid portion will come up. This is plasma. Clear? So in serum, some clotting factors are deficient. Now these are 3 anticoagulants used in clinical practice in our labs. This for serum. Now how to collect the sample? Now there may be some mistakes. Actually, this anticoagulant, there is small powder inside or small liquid inside. Anticoagulant may be in powder form or in liquid form, both possible. But routinely, this is supposed to take some specific quantity of blood. Here, this is not a big problem. This way, if you want to prick it, there is specific negative pressure, vacuum inside. This will suck a required quantity, maybe 3.5 ml like this. Mix it. This is mixing. And this is shaking. Shaking is not allowed. It will hemolyze the cells. This can change the results. Shaking. Only mixing. Or this is mixer. This machine will just put it here. You will see in hematology lab, this is always revolving like this. Take the sample, put it here like this. Clear? This is just move it like this. So, slowly. Tube is moving. And this mixing the blood sample all the time. So very important step to mix the sample when you take the blood. If you don't mix it, what will happen? There may be small clots, micro clots inside. For example, you mix it after 4 or 5 minutes. Small clot down, lower side have more anticoagulant. So this is homogeneous blood. Upper side you did not mix, so there are small clots. Then you mix, but these clots are still there. So when you will take the sample, if there are 1, 2 clots inside, you take only 20 microliter or something. So this will rise the hemoglobin. Hemoglobin will be high, falsely high. If you take without any clot, so it may be a bit low. So this is not homogeneous sample, not acceptable for these tests. Clear? So very important step to mix the sample just after collection of blood. Clear? Another thing, yes.
How long do you mix the blood?
5 minutes.
Not 5 minutes. If this is okay, take the sample, put it on this machine.
All the time? Yes. Until we use the blood?
Sabr sure. Until you do the test. This is revolving like this, okay, this will be moving. Otherwise, just mix it. If this is a liquid anticoagulant, then maybe 2-3 times sufficient. If this is powder form, then you need more mixing. Maybe 7, 8, 10 times like this. You mix it, then you can leave it. Now, another thing. You have taken the sample, you have mixed it, but you will perform the test after 1 hour, for example, and you leave it like this. So what will happen? The red cells are suspended in plasma. These will settle. These are heavier. These will settle down. Red cell by so Lower portion will contain, now see this, if you can see, the upper portion mainly plasma, lower portion more cells. So if you don't mix before you, when you are performing this test,
So yeah.
just before performing the test, if you don't mix, so if you take the sample from the upper side, hemoglobin may be 4 gram, person is normal. If you take it from the lower side, more cells, this may be 24 gram hemoglobin, 28 gram, double. Huh? Almost, just roughly speaking, 50% is plasma, almost 50% for cells, red cell, main red cell. Clear? So just before you take the sample for the test, so this is very important to mix this again. Understand? We have this type of hematology analyzer, this machine, Holter counterfigure, maybe different machine for RBC, hemoglobin, PCV, white cell, differential count, platelet, many things you can do with this. But if we have to just feed like this sample. If you don't mix it, if we do like this, and that tube is taking the sample from the upper part, plasma, everything will be low. If this is taking sample from the lower side, everything will be high. Similarly in manual test. So 2 times mixing. Please remember this, in hematology, 2 times mixing. One, when you take the sample. Second time, when you take this small amount of blood for the proper test. Clear?
Sure.
So this is very important. This is collection. If there is some error at the time of collection, sometimes, for example, this is supposed to take 3.5 or 4 ml of blood. You take only 1 ml. This sample may be still acceptable. This is only in powder form. Still there may be no change or no big change in the result of hemoglobin, RBC count, white cell count, differential count. But there may be change in platelet count. Why? Because when only 1 ml means the blood is less, so anticoagulant is more than the required quantity, more concentration of anticoagulant. Clear? This we should take at least 3 ml. Here this is only 1 ml. This I am coming. This will stop. Sometimes you take the sample, sometimes this will, they are different. We will discuss this just now. If you take less quantity of blood, sometimes this is still acceptable for some of the tests. But you can ask the lab people, I have taken only 1 ml, can I send this for hemoglobin, RBC count, PCV, platelet, on this and that? Some tests, this is not acceptable, because this will change the results. Similarly, now more concentration of EGTA, anticoagulant, this will break the platelets. For example, this patient actually have 200,000 normal range per microliter. Half of these are broken into 2 due to more concentration of EGTA. Now this will give 300,000 falsely with more count due to more concentration of EGTA. Clear? But hemoglobin will be same, RBC count will be same, white cell count will be same, differential count will be same. So we can do this.
Clotting will be more.
More anticoagulant means less clotting. But this is sufficient to stop the clotting. This may be 3.5 or 4 ml, this may be 1 ml. There will be no clotting if you mix it properly. Understand? Now, some cases, Shabab, see this, especially in this coagulation profile. This is written here, you can see this too, 1.8 ml here. So this means this amount of anticoagulant is such that we should add 1.8 ml of blood here. We have to maintain this 1:9 ratio for coagulation test. 1 part of blood, 9 parts of, 1 part of anticoagulant, 9 parts of blood. So 0.2 milli, this is anticoagulant, 1.8 milli, this is blood. This means 1:9 ratio. 0.2 or 1.8. Clear? 0.1 or 0.9. Out of 1, 0.1 is anticoagulant, 0.9 is blood. Similarly, we can increase the volume. 0.2 is anticoagulant, 1.8 is the blood. 0.4, double than this, is the anticoagulant, 3.6 is the blood, like this. We have to maintain the same ratio. If we change this ratio, results will change. For example, here in 1.8 ml, you take only 0.9, half than the required quantity. So this means the concentration of anticoagulant is double than the required concentration. Clear? Because we are taking half amount of blood. So anticoagulant is fixed, already put here. So this means anticoagulant is more, so this can change the results. This sample is not acceptable. We call this inherent error. Inside the sample there is some error and no lab can remove this. You can repeat this 100 times, 10, you can send to any lab. Only way to remove this error, take the sample again in a proper way. Clear? So this is what are the sources of error at the time of collection. Clear? So we should collect a proper sample. Now, sometime you have to store it. For example, you take the sample on Thursday, after Zohar, you send it to lab, they refuse. Okay, we have finished. We will do this now on Sunday. So you, okay, keep it in the refrigerator, we will send this on Sunday. So you are sending this after 48 hours. Then for some tests this is still acceptable. Hemoglobin, usually no problem. If there is no infection, khalas. Even after 1 week, no problem. If some red cells are hemolyzed, broken, still hemoglobin is in this sample. Mix it, result will be the same. But RBC morphology will change, white cell morphology can change, platelet count will be reduced, this is a short half-life, so these results are not reliable. So storage can change the results. Clear? Third thing, transport. When they are taking the sample, anybody, your ward boy, anything, person from the ward, this is taking the sample to the lab, but he drops the sample and do something like that. So this can hemolyze the sample, maybe partially, maybe, or in place of mixing, this is mixing, and this is shaking. In place of mixing, somebody vigorously shake like this can hemolyze the cells. So hemolysis will change the results. Clear? So all these are steps where there may be some error and this can change the results. Proper collection, proper storage, and proper transport. Another thing very important to remember for you people, when you take the sample, label it. Write down the name of the donor, Sahib Dam, patient. This is not you, you are taking the sample. This blood belongs to this person. For example, we want the glucose estimation. He has collected this sample from this. So no need to write his name. We are not concerned with him. Any test we will do, this is for him. Understand?
Yes.
Name of the patient. In some cases of blood bank, they will say, okay, write down the name of the collector also. If there is any problem, we should call him. What is the problem? This and that. Oh, that is different. For routinely, this labeling for the patient. At least for donor or patient. Here at least you should write the name and date. In your clinical practice, you should be clearly able to distinguish different samples. For example, if you collect 10 samples and two persons have the same name. And you cannot distinguish, this is Ahmad this one or Ahmad this one. Then what is the use of these tests? Maybe this glucose level, this one or this one, this hemoglobin, this one or this one. So you should be able to properly identify to which person this sample belongs. Understand?
Yes.
This proper labeling, very important step. This is another common source of error in your clinical practice. If you don't label it properly, there may be some mixing, and all results are just useless. If you don't know to which person this belongs, then no use of this. Now, how to collect the sample? I will show you this here. Shiva, you have now, from where you take the sample? Mainly, we take the sample from the veins. In adults, in small children, if you need only small tests like this hemoglobin estimation, we can take with the prick, lancet. You know this, heel of the foot, ear lobules, or this finger pulp. But the main thing here, you clean this area and prick bit boldly. There should be a free flow of blood. If you prick here very kindly, this is your friend or your relative, then you press it like this. This is not proper sample. Maybe hemoglobin actually is 14 gram, and with pressure like this, there may be 8 gram, because more plasma is coming out than the red cell. So in this prick method, whenever you have to use this, there should be a free flow of blood. Prick it bit boldly, then wait, blood drop should come out automatically without any pressure. Clear? But mainly we will need this venous blood. And in this is our first choice, veins in the antecubital fossa, in this area. And these are 3 veins. This, due to some hematological variation, any one of these may be more prominent in different persons. So any one of these, you can see this is thumb side,
Radial.
cephalic, this small thing, basilar, and in between, median cubital. So in any one of these, usually any one of these may be larger, more prominent. So any one of these we can use. Not specifically any one. Mainly this is median cubital in most of the people. So we can use this, but not necessary. Any one of these 3 which is more prominent, more clear, you can prick, you know this. You should know the direction of the vein, where you will prick and how you will go. Needle will go like this. Here needle will go like this, needle will go like this. Position of the patient, this is also important. If you are sitting almost on the same level, this will be easier. And you should sit in this position. For example, here you want to prick here. So, yes, remove this. So you should be able to prick properly. You want to go in this direction, like this. If you are sitting here and you prick like this will be wrong. You can prick the other side of the vein. Position should be proper. I will explain this here also. Then, when you want to prick, first you can put this pressure here, tourniquet. If this is not clear, the vein will become more prominent. You just decide where you want to prick. For example, you have decided you will prick this area. Now you can remove the tourniquet. This should not be there for a long time. Clean this area with alcohol swab. Wait for a while, just maybe 1 minute, half a minute, or 1.5 minutes, like this. This alcohol should evaporate. The area should be dry. If this is not dry, you just clean. This is wet with alcohol. You prick with the needle. What does this mean? You are forcing some of the alcohol to go inside the blood. of this Muslim brother. So this is not good, but medically this will cause irritation, this can cause hemolysis of the red cell. So this can change the results. Understand? So just wait for drying, then prick. Now when this is dry, now put the tourniquet again, because actually, ideally, you should be able to take the sample within about 1 minute after putting the tourniquet. Even prolonged stasis, this can change the results. Understand? Why we don't put it here and clean it, wait it, this and that? No. When you clean it, everything is ready, put it again. There should be proper circulation. So we need a proper sample. Then prick. This is vacutainer system. I will explain this, what we have here. You have taken with the disposable syringe. This is almost very much resembling, but small difference. This has some advantages. Maybe initially you will feel a bit difficult, but you have to learn this. This has some more positive points. What if you are taking with the syringe? Now you want, for example, one patient, you need 2 ml for CBC, 1.8 ml for coagulation profile, maybe 4 cc for some serological test, biochemical test. You need the serum, or you have to put this. What syringe you will need? How you will take the sample? With syringe, yes? Which syringe you will use? Routinely you use 3 ml, 5 ml. But here if you use this 3 ml, 5 ml, how many times you have to prick?
3.
Maybe if you prick for every test, CBC, 1 prick. Coagulation profile, another prick. Serology, another prick. No. You just make an impression. How much blood you? For example, you need 8 ml of blood. This will be sufficient. So you can use 10 ml syringe. With 1 prick, you can get 8 ml, a bit more than this. Then remove the needle, deliver this to different test tube according to your labeling for different tests. So you should be able to take the sample with 1 prick. But this is the advantage. With this system, with 1 prick, we can change these vacutainers. First take this for serum, then for CBC, then for coat like this. I will show you how to remove this. How we can change this. With 1 prick, we can get many samples for different tests. Yes, now when you clean it, put the tourniquet, prick it, then this angle for the needle which you are inserting into the vein. Maybe with the syringe, maybe with this vacutainer needle holder. I will show you this here. Anything. The angle of this needle and between this arm should be fully extended. This angle between this arm and this needle should be
44.
Between 15 to 30 usually. This is sufficient. Less than 45 at least. If this is more than, the more chances to prick the other side also. More vertical position, more chances to puncture the other side. In lateral position like this, there is more distance. So I will show you the lumen, the mouth of the needle, all this should be inside. Understand? If this is like this, there is less distance, so you will easily, quickly you will go to the other side of the valve. What will happen in this case?
Breathing. Hemorrhage.
No. This sample. This is the difference. This means you have punctured the proper vein, but when the needle was, lumen of the needle, mouth of the needle, this was inside the vein, blood is coming. But you did not stop there. You punctured more and puncture the other side, and again the lumen of the needle is now in the muscle. Blood will stop. Understand? So we'll take a little quantity.
إذا أنا زودتها
This is needle. This is the vessel. If you puncture like this lateral and stay there, blood is coming, you will feel like this. Like this. 4 ml, 3.5 ml, like this. So if you go like this, more vertical, and you prick like this, when this was here, inside the vessel, some blood will come. But you did not stop here, you go and puncture the other side of the vessel also. Again, you are in the muscle, so no blood is coming. This will stop. Now, if this happens, no blood is coming. Small blood is there, then no blood is coming. Then what you will do? Bring this needle back slowly. Bring this back in the same angle. Just
pull it back.
come back. Bring the needle back slowly. And a point will come when again blood will be coming. When the lumen is inside the vessel, blood will coming again and stop here. Wait till it is filled. Clear? So now here, these things, Yashabab, come here. This side and this side. You should be able to see this. Now all these things must be in your reach on your table. There is no big team, only one person to take the sample. Maybe you will see in the hospital, only one nurse, one doctor, not. Okay, give this, this is not proper way. First take everything on your table, then prick the patient. Now another important thing, for example, I want to prick him, this should be almost same position, not like this. If I am sitting here, this will be difficult to almost similar height. Like this. Just show. I will not prick you, inshallah. Show you, then you can prick yourself. Oh. MashaAllah. Sometimes the veins are not clear, so you can just apply this tourniquet. Yes, Shabab, you can apply this pressure with anything, like string or something. Even if the hand of some other person. Now, first we press this just to visualize, see these veins. Now this is more prominent, we can decide where we will prick. You can see this direction, this is medial cubital vein. So we can decide, okay, I will prick here. Clear? Now release this tourniquet. Because they should not be here for a long time. We know this area. Yeah, don't worry, I will not prick. Now, this is alcohol swab. Clean it with the alcohol swab. Shabab, see this. This from the center to the periphery. This is surgical cleaning. From the center to the periphery. Then wait for a while. Now this is needle. This is needle holder. Don't throw this needle holder. When you finish, please. This we can use 1,000 times, no problem. Don't throw this. This is a big problem. So many times I remind this, but still they are throwing this. This is important point here. This needle, this small seal, this paper should be intact. If this is already broken, don't use this. Maybe already this is used. Now you will break like this. Like twist this. This seal is broken. If you have broken this seal, this means this is unused. So this is sterile. Now this side. Now fix it here, like this. No, this is like shrink. Yeah? Now this is dry. Put this
Again.
Put this again. Now you know where you have to prick. This area is clean. You should not touch it again. Now this is the area. Then this should be in your reach. Now there are two ways, Shabab. See this. First thing, you prick it first, then push it. Other side, you push it first.
This is the better.
This will suck it, but the problem is this needs some experience. Otherwise, this try to come back. You should be able to support like this. Then prick it 15 to 30 degree angle. This is the medial cubital vein. Prick it. 4 fingers here, 1 thumb here. This should be down like this. Already this is pricked. Okay, blood will be coming when the needle is inside. If you prick, you first prick with only needle, then with these 2 fingers, this here, this thumb here, press like this. When this will,
Again, doctor.
you have prick, needle is inside. Now you take this like this, 2 fingers here, the needle holder, this thumb here. Blood will not be coming till you press it. Press it like this. Now this blood will be coming here due to negative pressure. Some vacuum is here. Not the position should not be like this. Blood will not go against gravity. Understand? This should be like this. Now don't worry about this. When this is filled, automatically this will stop. If you want to take more sample, okay, take it out, mix it, and then you can, for this example, this CVC, this is coagulation profile. Fill it, then for other tests, maybe for heparin, this one, or for serum, the other one. 1, 2, 3, 4, 5, you can fill it. Ya Shabab, please remember this. First you will, when you finish, first release this tourniquet, then put some cotton swab alcohol here and take it out gently. And
Pressure.
maintain this pressure here for 3-4 minutes. You should remember this. This is a very common mistake. Don't do like this. If you do like this, fraction, there is some pressure, blood will stop. But when you extend it, again this is open, blood will come out. So maintain this pressure in extended position. Initially, you will learn in next semester, I don't know, maybe you know from your physiology, when there is any injury, initially platelets will come. There is aggregation of platelets. But this is fragile, unstable plug. This can be broken any time. Then fibrin deposition is there. This is a stable plug. That will take some time. So you have to wait for that time. If you don't wait, there is some oozing. Some blood will come out of the vessel under the skin, subcutaneous bleeding. And there may be a very bad looking area here. This is also painful. This is bad looking. If you maintain this pressure for 4 or 5 minutes, then remove this, see there is no bleeding, then put the Mediplast. This is the proper way. That's all. Okay, now Shabab, see this. 2 persons in one group for only this practical. Up to you, your own friends. Everybody will donate, he will donate, he will collect. Then he will donate, he will collect, like this. You can fish and... Yes, Shabab, another thing. When you finish, remove this needle like this. This needle in that yellow basket, plastic basket, dark container. This needle holder back on the table, not in the garbage basket. Don't throw this, please. This tourniquet, this needle holder, or anything you will not use, like this. You put extra, this is not used, put it back. Don't waste these things. All these things, other than the needles, in that big basket, that is there. radical waste. Okay. Sharp containers here.